Good afternoon, ladies and gentlemen. We're delighted that you are with us today, and our webinar is now beginning. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we want to thank each of you for taking time to participate in this educational webinar, hosted in coordination with East Texas A&M University, who is an associate member here at the Council. Today's topic, promises, pitfalls, and pressures, AI's impact on healthcare and public health. As we all know, this is a very hot topic in today's industry. East Texas A&M University is a relatively new member of the council. We're delighted and happy that they will be willing to host this discussion today. And they have campuses across Dallas and the surrounding regions, and they deliver 140 post-academic degrees and serve more than 13,000 students. In this webinar today, we're going to explore the pressures of AI using real-world examples of research and current events. We're also going to discuss why it's so important to prepare leaders through interdisciplinary programs that are critical to ensure that the tools advance equity, reduce costs, and build healthier communities. We're delighted today that we've got an expert speaker, Dr. Elizabeth Wachira, an associate professor and public health program director at East Texas A&M. She has quite the resume with over 15 years of experience in nursing, health promotion, and education. One administrative note, please put any of your questions into the question box that's here in Teams. And at the end of her presentation, we'll be more than happy for her to answer those questions for you. With that said, and without any further ado, it's my privilege to introduce Dr. Elizabeth Wachira.
Thank you. Thank you, Stephen, and thank you to the council for everything. My name is Dr. Elizabeth Wachira, or Dr. E, as my students at East Texas A&M call me. And I'm humbled to be here, and we're going to dive right in. Now, expert was used, and I am an expert talker in all things public health. So that is what I'm going to be just highlighting today. And I know this is a hot topic. This is something I am sure that we all have read about, we are using, we're being trained on. So I will make sure to not be laborious on the things that we know, but it's always good to hear them again. If you are like me and you had a very disciplinarian mother, you are reminded multiple times about something. Take out the chicken out of the freezer 50 million times, and sometimes we forgot it, but sometimes we remembered. So I'm just here to just highlight maybe what we know, but also call attention to some of the pitfalls and pressures that we need to take caution on. So all right, so we all represent and work at or for hospitals, and we know that there are many challenges that are facing what we do. How can we continue providing quality care while costs are rising? Everything is rising. Gas is rising. The cost of internet is rising. The cost of keeping a building running efficiently is rising, and so are the cost of providing care. So in this place that we are, where we are facing these challenges, rising costs, our population, unfortunately, is getting sicker and quicker, right? Data is showing that individuals are living with multiple chronic diseases, and we're seeing some of these chronic diseases that we used to see in our elderly age group happening even in the 20s and 30s, cancers, for example. Burnout, staff burnout, and persistent disparities, inequities, right? Differences in one population being healthier than another due to affordability access issues. And AI, artificial intelligence, has been given as a tool, a solution to these challenges. How can we improve efficiency? How can we make decisions quicker, train our professionals faster? And how can we mitigate inefficiencies and disparities? Well, artificial intelligence is a solution marketed to do that, and we know that it is. But the question that I want to have us all on the back of our mind is, will AI relieve or precipitate current and new challenges, right? And what are those challenges? My talk is not about the downfall of AI as something we do not use. No, we are using it. It is being integrated. It is being helpful. But in the process of doing that, we need to have caution. This is there's a green light and there's a yellow light, and this is a yellow light kind of talk. What are these places that we need to highlight and showcase? And hence my topic on promises, pitfalls, and pressures. And at the end of that, we're going to talk about what the implications are for us in healthcare, for us in public health, for us in the health industry. What does that mean for our staff? What does that mean for the next generation of professionals coming in? So the promises, the potentials of artificial intelligence, they are there, they are many. We're going to highlight these. And then the pitfalls. These are the places where we need to just be a little precocious, right? AI adoption can cause harm and reinforce inequities. And what are these pathways? Where are these inequities and places that we need to tread a little carefully to ensure that when we do use AI in what we do, that it is not having negative consequences. And the pressures. This will highlight environmental, financial, and social costs that the unintended consequences, I think, is another way of saying that. So that will be what the webinar will cover. And of course, I am here with East Texas A&M University. So I will talk towards the end about our MPH program. And I'm a quote person, so there are two quotes at the very bottom of this screen that I want to share with you. One is from Albert Einstein. We all know him, right? The measure of intelligence is the ability to change. And talk about change in this AI era that we are in. Every day, we're having better ways of doing something. We are having more innovation coming in. And Albert Einstein is telling us that the measure of intelligence is the ability to change. And Charles Darwin, it is not the strongest species that survive, nor the most intelligent, but ones that are most responsive to change. So change is coming, change is happening, and every day in this era of artificial intelligence, there's new development, new ways, better ways, more efficient ways of doing something. And we can get caught up in the upkeeping of with change, and there can be burnout. It can be overwhelming because if I'm a nurse, not only am I having to provide care to my patient, but now we're using a new tool that integrates AI in this way, and that's another learning curve, right? So, but at the end of it all, change is here, and I think it's a quintessential driver of change, and we are being told to be adaptive and responsive to that, right? So what are the promises? We like promises. This is the rainbow after a bad storm, right? What are the promises of artificial intelligence? Well, very quickly, we are making quicker data-driven decisions, right? That lead to improved patient outcomes and increased efficiency. It takes us a shorter amount of time to review a large amount of data. We are able to use past knowledge as we generate it to make decisions in the moment. And when used well, we are seeing improved patient outcomes. Even our patients are using artificial intelligence in ways, and there are improvements, there are efficiencies in our everyday life, right? So when we look at predictive analytics, we're able to forecast certain things, ER visits, staffing needs based on the demand, right? Based on the demands, we're able to make quick decisions on how many providers do we need in this moment. What we're able to analyze, how are patients navigating or getting through from the door and coming outside that door. We see this even in the DFW airport for those that have traveled through that, which is all of us, right? I'm able to get online and see what the wait time is for Terminal E and or Terminal B. And the computer is using information current and past to give me that. And it is accurate, depending on what time you travel, right? And clinical support. Clinicians are being able to be assisted with imaging. We're seeing a lot of AI usage in primary and secondary prevention, screening, early detection, precision diagnostics, and being able to predict certain outcomes and mitigate those that are negative. In our EMR records, right, depending on words and charting that is used, we're able to identify risks, right, determinants of health outcomes, impact, and all these things to be able to know based on this note and based on what we know, this person may be at higher risk for this, right? Predictive and all those things. And efficiency. Man, who does not like when you go to the airport and it takes you 15 minutes to get to your gate and you still have time to walk to Starbucks, get that chai latte and sit down, open your laptop and work or maybe watch Netflix. I mean, streamlined workflow. It works perfectly and beautifully. And as a result, we're reducing waste, we're saving time on things that need to be saved time on, right? So the promises are many. The promises are many. And then there are pitfalls. Pitfalls are those places where we need to just take a cautionary step, right? If we don't do something, the outcomes of that are going to be negative in terms of there's going to be exacerbated disparities. So, for example, with artificial intelligence, it is fed data. It is or data. My accent, I'm East African, so data. It is the algorithm that informs the output that we get. The data we put in determines the output we get. If you've taken statistics, bad data in, bad decisions out, right? So here, AI systems are susceptible to bias and inequities. So if the data that has been fed is not representative of the demographic that you serve, the decisions will be representative to a very particular subset of the population. Now, when we talk about large amounts of data over time, right? And if there is bias in how that data is collected or transcribed, well, the algorithm can only use what we have fed it. And if the data is non-representative, it can lead to, unfortunately, inaccurate diagnoses for a subset of the population and ultimately outcomes, because maybe it may not catch early detection that mammogram, a positive mammogram for, let's say, a woman of color, right? And there is data and research out there showing that diagnostic tools, we are seeing some false negatives, right? And so when we use artificial intelligence to feed us large diagnostics insight and data, the output of that is we'll have a lot of false negatives, right? And then there are ethical dilemmas, of course, patient consent, data privacy, accountability. I mean, when you open your Google chat or to type in something, now you're getting an AI generated response, right? And it links to certain things, but there's also data being collected there. What are you searching for when we input information? Privacy issues come about, right? Accountability for the decisions made by the algorithm. So there is an ethics component that we must take care of as we are using these tools. And then security risks. How many times has my cash app or something come up that there's been a breach, or that I was on Facebook or on this site and there has been a breach in data and it's been compromised? Patient information. We deal with very highly sensitive patient information. And the more data and the more data points and the more sharing points we have, the more opportunities for a breach in some way. And if we're not careful, this can ultimately lead to a loss in a trust in healthcare systems, right? And depending on how data is managed, even legal ramifications, if we don't do the work ahead of time to make sure that our laptops are secure, the records that we are assessing, where we are even assessing those, there are a lot of security risks that come with the use of electronic records. And now, since there's an AI integration part of it, and these are pitfalls in terms of there's a pit. We could fall in it, but we got to put some caution marks on there to make sure that we mitigate the outcome of bias and inequities. And we know that inequities are on the rise: socioeconomic inequities, access, affordability. But now another part is decision making and care. Um, and another one that I want to really bring for us is desk killing. Right? There is a study that was published by Lancet that was looking at doctors that use certain AI support tools to identify polyps and abnormalities. And with the dependence of AI tools, there was a 20%, they became 20% worse at spotting abnormalities on their own. Desk killing. Now, whoever coined that term, you clock it, we get it, because dependence on AI, and we see this with creativity, the more we depend on this tool to do everything, the more that ability to critically think and the ability to think quickly or creatively is being targeted. And this is a major ramification, right? Major ramification, because 20% worse, that's a lot. And then over time, now, this was in Poland over time across the entire globe. What does that mean? So, even as we use these tools, we need to find a way to also upkeep our skill set, upkeep the time that we spend in class learning, in residency, in clinicals, learning these skills to be able to identify something. And affordability and access gaps. We cannot not discuss this. The cost of AI integration into a healthcare system is quite high. And there are hospitals and clinics and organizations that may not be able to afford this cost. And typically, if we look in rural communities or other hospitals that are safety net that cannot upkeep this cost, that means that the data that they're collecting that is representative of a subset of the population they serve may not be picked up in the larger algorithm of things. Because if we talk about social determinants of health, low income, access, affordability, individuals that do not have insurance or good comprehensive health access, they go to certain very specific hospitals, clinics, or organizations. And if those clinics, hospitals, organizations are not able to afford this cost, we are missing a large subset of the population that we need to be able to now make decisions that are representative of our entire population that we all serve. And then poor integration. We, the humans, we, the people, are needing to use these tools and we're needing to learn how to use them. And there can be frustration and stress and even burnout because now this is one other thing that I need to do a training on. This is one other thing that I need to learn about and use. One other data point that I need to input here. So this also calls attention to the need for conversations with not only the end users of AI ourselves, but the designers of these algorithms, the designers of these data centers, the designers of these tools, to where we can sit and have a conversation in our language of choice, but it's one that is not jargoned, to where that individual that's a software engineer or this engineer can talk to a nurse, to a clinician, to a community health worker, and understand the needs of the end user. So that way, whatever it is we're designing, it's not negatively impacting us and our ability to give that human to human interaction, but it is also not creating pitfalls such as this. So the next conversation needs to be, how do we have intentional, impactful communication with the designers of these and the end users of these to ensure that these pitfalls are mitigated, right? Now let's talk about the pressures of AI on the environment. This is where I live, work, and play. This is now, at the end of it all, the public health, specifically environmental health. And the pressures of AI on environment, I'm going to also call them the unintended consequences. They were never intended. They're not intended. I refuse to believe that they were intended, but there's still consequences. And so there are unintended consequences. Paul Farmer, a medical anthropology, talks about the unintended consequences of policy. There are things we need to also consider and think as we create policy, as we use AI, as we integrate AI, to make sure that these outcomes do not negatively impact the people and the globe. So as AI usage increases, data centers also increase, right? And data centers are the brain centers of these of AI. So facilities that house computer servers. And as more AI is integrated, as the demand for computer usage and running algorithms and running data and analyzing large data is needed, more data centers are popping up left and right. And this is where we process everything that we are inputting into ChatGPT or Gemini or Copilot or a Claude, whichever platform you use, right? Now for a hospital and or for a business firm, right? Not just Elizabeth and my internet usage and my phone, but when we talk at now the organizational level, which is where we all are at, what does this mean? It means the more demand for AI, the more demand for analysis of large data, the increase in data centers, and they are increasing and projected to increase. So what does that mean? Well, high energy demands. AI requires massive computing power, massive. When we talk about not just a hospital, but all the hospitals in the Metroplex, and then now all the hospitals in another state and elsewhere, we're computing massive amounts of data. And right now, 4% of national electricity is attributed to AI usage and expected to double significantly as AI expands, as our ability to intake and analyze data quickly expands and the reliance and the use of that, there's more demands energy-wise. Think about just even your basic laptop. When you're using it, you're doing a lot of data, you're analyzing a large something, it slows down, it gets hotter, right? So your laptop can get super hot depending on what you're using it for versus just responding to an email here. So water usage. Water is needed to cool these servers, and they get hot, 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 hot. Go to wherever the servers of your hospital is, and you will find that room is steamy when the rest of the other rooms are cooler, right? So we are needing more water to cool these servers. And it's projected that a data center uses 2 million liters a day. Now, as more data centers pop up and they do more, it's only logical to expect and project that usage will increase. And we have data centers in Cali, in Texas, in Arizona. And if you've been to Arizona, you know water is an issue already. So water consumption for community, water consumption for the city where these data centers are being built is something we must consider. And water supply, right? We must consider that. And lastly, noise pollution. I didn't think about this until I started reading and talking about this. If you right now my computer is humming. I've been on it since 6 a.m. Right? It's saying, Elizabeth, stop it, shut me down, put me in a cool room, let me relax. That's just my laptop that is humming. Now think about a data center that is storing all these large, massive servers. The constant hum of generators and cooling fan can reach upwards of 85 to 96 decibels. And after a little bit of research, the daily safe level, exposure level is 70. 85 dBAs with prolonged exposure can lead to noise-induced hearing loss. Now you may be like, I haven't heard any data centers humming, but individuals that are living in certain environments and communities where these data centers are being put up, they're living with a constant leaf blower generator all the time. And nearby populations, sleep disturbances, anxiety, stress, right? These are some of the negative outcomes that could result and are resulting as a result of this. And wildlife is impacted, disrupted communication and migration patterns, because we know the little I know about animals, they are able to hear things that we cannot hear. So imagine how magnified this constant hum is and how it is disrupting communication and migration patterns. Now, these are pressures on the environment. Pressure as in with time. Over time, if that pressure is not released, there's some negative unintended outcomes that we will deal with, right? Sleep disruption, anxiety rates. We know that anxiety and stress is at an all-time high because of all the uncertainty and the things happening, not only in our city, in the state, but the entire globe. Now we add this one on there as well. Wildlife, noise-induced hearing loss, stress is tied to health, right? Higher levels of stress, continuous stress all the time is tied to cardiovascular risk and other things, obesity, all these things, mental health outcomes. And what does that mean? We have a sicker population, a sicker environment. And that's why this slide is very important and intentional on the title, pressure. If pressure is not relieved, if we don't circumvent that pressure and find how to mitigate that, and take caution, the unintended outcomes of this at the larger scope are high and costly, right? So what are the implications of all of that? Man, Elizabeth, you talked about a lot of things, the promises, the pitfalls, and the pressure. Well, I think the most important one is integrating AI responsibly. I've also talked about the need for intentional conversations between the designers, the end users, and even the beneficiaries of the tools that we are using in patient care. Continuous evaluation of AI tools. How is the integration of this? How is that impacting our skills? Are we seeing higher rates of desk killing, right? Are we losing our critical thinking ability? Are we using our ability to think fast or to analyze, even like to identify something? is dependence on AI, codependence, right? Codependency on AI. What are the implications of that at the service provider level, but now the environmental level as well? And collaboration, what I talked about in my image, I just realized is covering that. Collaboration with stakeholders, individuals that are creating the tools that we are using. People, the ones that we are using that, whether that is in academia or in a business or in healthcare. Let's talk about that. And then educating and training for healthcare professionals is needed, right? We need to, if we're expecting our doctors, our nurses, our clinicians, our community health workers to know the promises, pitfalls, and pressures of AI, the education and training before they get into the service provision context are needed, right? What does that look like for continuing education? Are there trainings that we can take for clinicians, AI and ethics, right? AI and policy, AI and environmental health, public health, inequities. So as we do that, now for me as the program director for a public health program, what does that mean in the classroom? What projects, what exposure am I giving to students? And this segues me beautifully. I mean, talk about beautiful. We're going to land this plane safely at Love Fields today. Public health at ETAMU. I am biased, but I think it's the best program that we have, that I know of, at least in this moment. It helps that I am a part of that program. But public health at ETAMU, we have my goodness, what am I trying to say? We have two tracks, community health and epidemiology. Our class sizes are small, right? We range anywhere from 10 all the way to about 30, 35. Majority of our classes have a service learning component. This is important, and this is my big bragging point, because we have to ensure that our future healthcare leaders, our future providers and health professionals are able to apply abstract concepts and apply them into the real life experience. What the case study in the textbook is completely different from the case study on the streets, right? In that clinic. And so service learning projects allow students to take what they're learning in the classroom and apply it to an agency of choice, right? So for example, one class is program planning and implementation that I'm teaching this fall. Students walk through designing a program of their choice for whatever agency and organization. That class has students in healthcare leadership, in public health, in health kinese, in even some depending on social work, right? And so they're learning interdisciplinary, but they're also working on projects that are near and dear to their heart. And we charge them with, hey, if you work as a nurse, if you work right now as a data analyst, if you work as whoever, think about a public health issue in your a public health issue in your organization, and how can you create a program to mitigate something, a public health issue, burnout, stop burnout, um, training, MRSA infections are high. Falls are high among this demographic you're serving. What can we do? And they plan that. But then they take 3 of those strategies and they implement them in that organization. And what they come back and tell me is, Dr. E, what I planned, what I saw in theory, and what happened in real life, 2 complete chats. I wanted this, but this is what happened. And then I say, okay, how did you adapt? If you were to do this again, what would you do differently? And they say, I would actually do more listening to be able to design something for my front-facing community so that I can ensure that what I am designing is, one, what they need, and I can take account of why they can and cannot attend that program. What that does is it allows students to know we're not in a microscopic lab. when we are learning. We have to live with the context and the realities of the world that we are in. And how does that impact our decision making in public health, in policy, in economics? And so that's what we do. And a perfect shout out is one student that took this class in healthcare leadership got a job as a project manager, in program management, because she had the skill set. And she, in the interview, used what she did and what she learned to talk about how she has adapted programs and how she managed that program from start to finish. So we are seeing our students not only learning new skills, but being able to really use them in whatever industry they're in. It's flexible, online program, but we do have a Dallas site as well. So we have students that if they need to be have contact hours, we have that. And then it's interdisciplinary. We have students from different countries, from different disciplines, and we learn together. And I will end with a call to keep this conversation going. I have my contact information there. I am based at our North Park Central Dallas site on, for those of you familiar with the Metroplex, on 75 North Park Center. And let me call out this quote by Dr. Mihaela Van Shar. She is at Cambridge University, and she oversees the AI and healthcare department, right? She is a clinician by training. And her quote says, "We need to design and build AI that helps healthcare professionals be better at what they do. The aim should be enabling humans to become better learners and decision makers." And that's what AI should be designed and built for, and it is. And it goes back to my point on stakeholders have to talk. The designers and the builders and the users of AI have to sit at a round table together and discuss how can we ensure that it helps us be better at what we do. And just two questions that I have that I would love anybody that has feedback. You can use the chat. But we talked about promises, pitfalls, and pressures. Um, what is an AI promise that is helping you be better in what you do at work? And any pitfalls that you foresee, AI related pitfalls or pressures that you foresee in life, all in career. Those would be some great, I believe, conversation starters and things to keep us going and keep us thinking about on this. And if I was to give a takeaway for this entire talk, would be let us maximize the promises, let us be cautious and know what the pitfalls are, and let us reduce the pressures of AI integration, design, and usage. And my last slide before I open up the Q&A is I'm going to do a shameless plug. One of my interns, I had an intern from UT Southwestern. She was doing an MD, MPH, and she did her internship with me, and it was a research internship. And she was matched a residency at um, a women's healthcare org, I believe in Wisconsin is where she is doing her residency, but her area of interest was women's health. And she wanted to know what are the implications of AI's effect on health equity for women's healthcare providers. And you can scan that QR code. It will take you to that article, and it calls attention to the need to stay informed, reading where we can current events on the intersection of AI and healthcare. It at least keeps our ear to the ground. What is happening, right? What are the promises, the pitfalls, and the pressures of AI in the work that I do? And then our MPH at ETAMU, you can look up ETAMU MPH and it will connect you with how to apply if you want to apply, or even reach out if you would like to know more. And I'm going to stop sharing and see what questions there may be or anything in the chat. Chris or Stephen, I will hand it to you there.
Great. Thanks, Elizabeth. What a fantastic presentation. While we're waiting for some of the questions that people may put in the Q&A and chat, I had a couple of questions I wanted to ask.
Mhm.
You know, you had two quotes about the ability to change and changing, and there's going to be a learning curve with this tool. What are your suggestions on how you keep the anxiety level down for employees as they learn more about using AI and using this tool so that it is, in fact, productive?
That's a great question. And I'm going to use, since right now I work with students, right? So I think it goes back to that really intentional training and not assuming that everybody knows or can use, right? Having a way for them to learn from zero all the way up. So one of the classes that I designed was on innovations in healthcare class to get students to learn for themselves what innovation is happening. And we know AI is it's there's a quote that talked about AI is a new electricity. How electricity completely changed our world is what AI will do, if not more. And in that class, it was very introductory, right, to what is AI, what are some promises, what are some ways you can use AI as a student, and designing assignments to get them to even know the different types of tools and guiding them through using that, and also giving them the feedback on the pitfalls, right? In terms of you have to fact check AI and how do you rely on it? Why should you not rely on it by use it as a complementary tool? So I believe even for employees, we have to have that education and training and create spaces for that learning to so that way we can guide them in this change. We can guide them in using AI 1.0 to 2.0. And I know the industry does a really good job. I remember working as a nurse as Connor White in Temple. There was a lot of opportunities for me to adapt a particular skill set if I didn't have that. So I think this is now another pillar of training and skill set that any industry for their employees has, because the more confidence you have, you feel self-efficacy, the more that anxiety kind of mitigates, right? And knowing that it will be anxiety causing. We have digital natives and we have digital nomads. So we, our employees represent all spectras of generation Z, alpha, baby boomers, and we have to be aware of that and create trainings and resources for every generation and in a way that as we expect them to use it, we take a step back and get them to adopt it and guide them through that adoption. I hope that answered that.
Yeah, it's a great answer. And, you know, kind of a follow-up. In your answer, you mentioned fact check. You have to
Mhm.
fact check it. When I talk to some of the clinicians at hospitals and even some of the CEOs, they see the importance of AI. They want to embrace it. But when you get into making clinical decisions, you know, you really laid it out nice. You want to do data-driven decisions,
Mhm.
but you don't want to have to be fact checking every time you make a clinical decision.
Right.
How do you know that you're using a clean data set that, as you say, does not have some inequities or bias inherent in it that you're unaware of?
Yeah. That's a great question. And I may not necessarily be the most apt one to answer, but what I would say is the research on AI in clinical decision making is there, and we are seeing the promises and the pitfalls. And one of the largest one is the inequity and the bias aspect, right? I think knowing that from the get-go and being aware that, okay, for example, if we're looking at breast cancer, diagnostic, mammogram screenings and all these things, if the research is showing that the the algorithm is biased to where it is not correctly identifying a positive mammogram for a woman of color, right? Being cognizant of that as a clinician is where I can say I have to be very careful here because and yes, you're right, we don't have the time, right? Because I know it's we want to be efficient with our time, get in, get out, we get that. But I think knowing that ahead of time and calling out those biases or calling out those pitfalls, and knowing that if I am an oncologist and I have a population that is different in terms of race or ethnicity, this is what the research shows on the pitfalls. And so I may have to take an extra step with this patient if she meets that demographic representation of false negatives, right? And now, does this add more to us? Absolutely. And this is where um, there's a quote when I was looking, I'm a quote person that talked about AI is only as good as we use it, right? So it is not there to replace, it is there to complement. And we still, as clinicians, human beings, we have that sixth sense. We have something that tells us, let me take a second look on this, right? And we have to rely on those qualities that AI, artificial intelligence, does not have, that we do, as it relates to they don't fit the classic profile, but there's just something that I think requires a second take. That is what I would say. And I think I would conclude with don't take the human intelligence out of the artificial intelligence as well.
Oh boy, that's a great quote. Talking about quotes, I like that. Don't take the
Yeah.
human intelligence out of it. I'm going to ask you kind of a tough question, somewhat unfair question. No political overtones on this question.
Mhm.
Today's the first day I really have met you, but I can tell you have a passion for public health.
Mhm.
You really do, and you're clinically trained. You've worked as a nurse. You know, I'm not clinically trained, but during the pandemic, I met with a lot of epidemiologists. I met with a lot of physicians, met with a lot of our clinical people who really worked hard during the pandemic to save lives. And the real tragedy, in my opinion, in the pandemic is how many people lost their lives. That's a given. But the
Mhm.
other big problem that I think came out of the pandemic was a lack of trust by people in the public health system in this country. It's not perfect, but it's getting a really bad rap. Look at what's happening in the CDC as we speak. I'll give you a great example. I'm an old guy, Elizabeth. I had mumps, I had measles, I had chicken pox before there were any vaccinations. But the measles vaccine very effective for 63 years. There's your evidence based, data driven information. And yet, you see what we're facing.
Yeah.
We're having to deal with measles. Can artificial intelligence turn around and renew public trust in public health?
Woo, that is a great question. And it has the potential to. Going back to the tool is as good as the data it's given. And we live in a time where anybody can generate any data. And if I use ChatGPT, for example, it pulls data from every source. And if the expert is not looking at that data to make a decision, that is where we fail. Because we have to allow the experts to be experts at their job, right? And public health experts are the experts on things related to public health. And but now with artificial intelligence, anybody can ask a question, and the data ChatGPT pulls is data from Wikipedia, from here, from there, from there. If, as a public health expert, I am able to look at an output and question that based on what I know from what I have learned theoretically and everything else. But if, let's say, a first year public health student that is using that and just using that itself, they will make flawed decisions because the data that is being used to make that decision, it includes both accurate, inaccurate, or misinformed information. And that's why I say it can, if it is used correctly. And if the data that it is using to generate decisions and information is data that has been generated by the experts. And in there lies the problem. AI is pulling everything. It's pulling what I wrote as a public health researcher on COVID, but it is also pulling an individual that leans whichever way politically or vaccine related and is generating that information. And it's using all of that to conclude and summarize. And going back to my last quote, we need to keep the human part in that intelligence. And why I said experts must be allowed to be experts in driving the narrative, driving the decision making, because I'm not a cardiologist. I can get on Wikipedia and WebMD about the symptoms that I'm facing, but it's going to pull a lot of things, and it may be it may be GERD, or it really could be a heart attack. But a cardiologist can look at all that and look at everything that they've been trained to do to say it is actually something related to here's a Tums, take a Tums. It's not a heart attack. And because we allow the expert to lead and be the expert. And it is possible if the data, the algorithm is trained correctly.
Right. You know, you've done a great job answering questions. I have one final question. I thought there was a question in the chat, but it was a compliment to you. Said you had done a great presentation. I totally concur with that comment. You know, you brought up some excellent information on data centers related to energy, water, noise, etc.
Mhm.
You know, here in Irving, we're based in Irving, the hospital council, right at Las Colinas Boulevard, there is a big data center being built. It's going to be a tremendous data center. You know, other municipalities are seeing the same thing, as you pointed out.
Mhm.
If you have one in San Antonio, one in Houston, one in El Paso, Irving, so on and so forth, how should they be regulated to deal with some of these negative things, energy, water, and noise? Is that municipality by municipality? Is it by the state? Or is it by the federal? Or do you have any thoughts on it? I'm not trying to put you on the spot, but if we know these are going to be problems,
Yeah.
how do we try to alleviate those problems?
Yeah, that's a great question. And the effort has to be taken to alleviate. And I will pull from because a data center, it's outputting something that may not be obviously visible compared to a coal factory, right? If you go to somewhere where factories are, you could see the smog, you could see the water is affected. But data centers, they're outputting, unfortunately, sometimes very invisible negative things. And I would borrow from what we know works or should work is all stakeholders involved have to sit. I am big on collaborative and sitting at a round table with the stakeholders, including the population we serve. And from the local all the way to the federal, we have to sit and talk about, okay, these are the pressures of data centers. And how can we, from local all the way to national, come up with good policies that ensure that these data centers, one, are aware and they have mitigation clauses, right? What does that look like? But unfortunately, we know that individuals, for example, if we look at Houston, uh, people that live close to factories have high asthma rates, all these things, right? People opt not to build there, so they go somewhere. So we create very unbalanced economies because of where proximity to factories. We should expect, using past history and past lessons, that this, if we don't take care of it, is going to be very similar to what we saw in the 90s, the 80s, and all these things, and hold to task our policymakers and involve all the agencies that have to do with environmental health and impact, to say, hey, there are consequences on climate change. There are consequences on what there are consequences on so many things as it relates to data centers. The stakeholders must first come and talk and sit and look at that. And we know that if nothing is done, history will repeat itself. There's a quote that says, those who forget history are forced to repeat it. And so we have to look at the history from the past and talk about how did these factories negatively impact population and environmental health, and say that is going to happen. What can we do? What has worked? What has not worked? And how does that look like for the local, the state, and the federal level as well?
What a great answer. You did a great job of really unpacking that and explaining it. You know, Elizabeth, this has just been delightful. You've done a
Thank you.
tremendous job uh, on a very tough subject, and one that, as you said, we've got to be willing to change and work through. And I
Mhm.
want to thank you, and I want to thank East Texas A&M University for this great educational webinar. And with that, Elizabeth, do you have any final closing thoughts before we conclude the webinar?
Yes, first is to say thank you. The second one is, if you have not looked at ETAMU MPH, what are we doing? Reach out to me, and not even just to attend, but also have conversations. I think at every table and space, there's an opportunity for that. But also, as it relates to this topic, let us be willing to lean in and learn. It's going to be uncomfortable, but there's a quote that says, keep leaning and